right, everyone, here is my week 3 spotlight. I'm doing it a little early because due to some prior weekend things that I have to do. So I am recording mine and posting mine now. I'm going to be talking about hospitals on tonight. Overview, what we're going to talk about today, we're going to deal with inpatient. What is an inpatient facility? What is an outpatient facility? The stages of evolutions of hospitals and the general type of hospitals that they have. Inpatient. According to businessjournal.com, an inpatient facility is categorized as a healthcare facility that requires an overnight stay. A healthcare facility that requires an overnight stay. Outpatient. An outpatient facility is a place where a patient can receive services without lodging there overnight. We know you have dentist offices are outpatient. Different specialty clinics are outpatients. Most of the time you can have some type of surgery or procedure and then you go home, so that is declared an outpatient facility. Stages of evolution in the hospitals. The first stage was almshouses as primarily institutions of social welfare and social welfare. The next thing, hospitals transition into being community-owned private hospitals as charitable institutions supported by affluent donors. We know we have St. Jude's Children's Hospital is a perfect example of that type of hospital. Also, university-based centers of medical research. You have University of Mississippi Medical Center in Jackson, Mississippi, where they have the medical school. A lot of work is being done there. In New Orleans, you have Tulane School of Dentistry. In Houston, Texas, you have Baylor School of Dentistry. Here in Knoxville, we have University of Tennessee, where there's a lot of research and a lot of things that are being done. Then the next phase it transitioned into down through the years, the emergence of medical systems providing a large array of health services. As you know, smaller organizations joined and combined and did acquisitions and mergers with larger organizations so they can provide more services. A lot of smaller places came together and they're all falling under one umbrella now. The last thing was an emergence of relatively small number of physician-owned proprietary hospitals. You see, a lot of that has taken place within the last 30 years. And the last thing that I want to briefly talk about with you all on today, the type of hospitals. There are 9 types of hospitals that are classified here. We've seen them. We've seen a lot of different things with these hospitals. This is just a general overview. And even in chapter 8 really deals with this and talks about in detail the type of hospitals, each hospital type and what takes place at the hospital. You have the community hospital. You have the hospitals that are private for profit. You have rural hospitals, public hospitals, general hospitals, teaching hospitals. I just talked about those. Private, nonprofit, specialty hospitals, and osteopathic hospitals as well. These are just the general types. If you go in chapter 8, you'll really get a detail of each one. It really goes into depth. Chapter 8 is a really good chapter. It deals with the beginning of hospitals, inpatient, outpatient facilities, and then it also deals with the evolution of hospitals, how they've changed, how they shifted within the last 50 to 60 years, and then it concludes with talking about the different types of hospitals. Thank you all again for your time and have a wonderful week.